Hello, welcome to our channel where we give tips for surviving motherhood and provide a place for honest conversations about women's mental health. We make new videos every Monday, every week. We hope you like our video. Don't forget to subscribe below. Today we're going to talk about the different treatment options for perinatal mood and anxiety disorders. But before we get into that, we wanted to mention that it's important to meet with your doctor and make sure that there's no health complications going on, such as thyroid problems or anything like that that may look like a perinatal mood and anxiety disorder. We also want to mention that in order for treatment to be most effective, it's important to get in as early as possible. So Bina, can you tell us a little bit about treatment options?
Yeah, and one thing about treatment, we know that it is really scary to reach out for help because unfortunately there is that fear that someone is not going to understand what you're going through, or that your baby will get taken away, or that you'll quote unquote get locked up. But please know that is not the case. There are a variety of treatment options available. And like you said, treatment is available, it is effective, and the sooner you get help, the sooner that you can start to feel better. So as we go through the different treatment options, one thing to keep in mind is that there are different treatment options. And so the first one most people think about is the idea of going on medication. And also just know that medication is a safe option. There are medications that are safe to take while pregnant and breastfeeding. So choosing to go on medication does not automatically mean that you have to stop breastfeeding. So that means it is important to find a doctor or provider who is knowledgeable about working with pregnant and postpartum moms, and PSI can help you with that. And another thing when it comes to medication is thinking about when to consider medication. A good general rule of thumb is to think about if you're feeling so bad that you're not able to try any of the other treatment options or tools, or you just can't function in day-to-day life, then medication may be appropriate for you to get you to that stable phase to where you can start using some of the other treatment options. And also another treatment option is therapy. And so when we talk about therapy, that can be done in different settings. You have your traditional outpatient therapy where you go once a week to speak with someone who can help you look at tools you can use to help with thought patterns, anxiety, and things of that nature. There are some therapists that even provide online therapy because we know it can be really hard to get out of the house with a new baby. Or maybe you just live in an area where you don't have access to those therapists that specialize in pregnant and postpartum issues. Therapy can also be done in a more intensive setting. You have inpatient settings, which is being in a hospital where you stay overnight and you're monitored with your medication. You have group therapy. And we are fortunate to have a few mother-baby units across the country in the US, not as many as we need. And then also we have what's called a partial hospitalization program or intensive day treatment, where you don't spend the night, but you go for several hours every day. And again, they do the medication piece as well as intensive therapy. So that's kind of the different levels of therapy that's out there. Felicia, do you want to tell us a little bit about some of the other options that are beyond kind of therapy and medication?
Yeah, I think it's important and good that you mentioned all of those options with therapy. There's a lot out there, so you'll find something that works good for you.
Absolutely.
We also have the opposite side, the holistic care, and it's more looking at creating support systems in place that really help you with what you're struggling with, such as lactation support, a birth doula, a postpartum doula, chiropractic care, sleep consultants, massage therapy, yoga, mindfulness, meeting with a nutritionist. These are a lot of different things that are out there, and studies have shown that they can be really effective.
Yeah, I've noticed that with a lot of the moms that I see, combining both whether it's medication and therapy with some of the holistic care pieces really does give for a good treatment outcome, especially with getting that support system, hearing from other moms who are going through it as well. Research shows that lack of isolation and being connected to other people with that social support does really help with the postpartum depression and anxiety.
Yeah. So that kind of leads us into support groups. And support groups are known to be a really big part of helping you feel better. And those are done kind of similar to therapy, or it could be or could not be, but you may meet with a therapist who leads a group, and it is a therapeutic support kind of group, and she gives tips and tricks and process struggles. Or it may be something a little bit more laid back that's just done by a peer, and y'all get to visit about the things that's going on in motherhood. And that's really nice to be able to see that you're not alone, and that this is mom life sometimes.
So true. And I think also the online support, sometimes people don't realize that online support can be just as effective as in person, because just that connecting with other moms, whether moms in your area, moms across the country, across the world, if you are isolated or you can't get out, just getting that support online can also be very beneficial.
Mm-hmm. It's easy to isolate ourselves as moms, so being able to get out there and interact can be really healing.
Yeah, and just even speaking to other people that are going through the same thing, or people that have come out on the other side, so that you know there is hope out there and that this is not forever.
Yeah.
Well, that's all for today. Today we discussed the different treatment options. Thank you for watching. If you or someone you know is struggling with a perinatal mood and anxiety disorder, reach out to the PSI warmline listed in the description below. Don't forget to subscribe to our channel for more videos about surviving motherhood. Bye.